My name is Ian Kelly and I'm an orthopaedic surgeon working at UPMC Whitfield Hospital in Waterford. This video about bunion surgery is an educational video for my patients. So a bunion is when the big toe drifts towards the lesser toes, potentially resulting in a variety of problems. It's very important to say that there are lots of people with bunions who function perfectly well and for whom the bunion causes no trouble. So most bunions do not need surgical correction. However, if your bunion is causing pain, despite exhausting all of the non-surgical treatments, I may suggest you consider surgical correction of your bunion. Surgical correction is typically performed as a day case procedure. So you come in on the morning of the operation and you go home that evening. It's performed under a general anaesthetic, meaning you will be fast asleep. And while you're asleep, I numb your foot. So when you wake up, you should not have pain in your foot. We then give you painkillers to take home with you so that you can stay ahead of any pain or discomfort. Your foot will be wrapped in a special dressing and you'll be shown how to use crutches for a 6-week period. Now, unfortunately, you can't drive until you are off the crutches. I see you back at clinic at the 2-week stage to remove the stitches, and then again at 6 weeks to get an X-ray. And finally at 12 weeks to ensure that you're happy with your outcome. 90% of patients who have bunion surgery are happy with their outcome, meaning 10% can have a complication. Complications include infection, so I really stress the importance of rest and elevation, especially for the first 2 weeks. You should go home in the back seat of your car with the foot elevated and raise the end of your bed at home. Some patients might experience nerve irritation, like a nettle sting, which typically settles with physiotherapy. The bunion deformity can recur in 5% of patients, and 3% can have an overcorrection of the deformity. Leg clots, residual foot swelling and discomfort, and issues with the metalwork can occasionally cause trouble. So while bunion surgery typically works very well, it is a big decision and should not be undertaken lightly.